We'd like to thank everyone for tuning in this evening for another edition of Life Sciences of Washington, How to Eat to Live, natures-v.com, and Natures-v Autoimmune Disease Foundation YouTube channel. Again, we're here today with biomedical research scientist and engineer, Mr. Victer Muhammad, and today we will be discussing reorganizing health sciences, an introspective view of the new health paradigm. Thank you for coming out today, Mr. Victer Muhammad. How are you?
Thank you for having me, and I'm well. Thank you for asking. How are you?
I'm fine. Thank you for asking also. The need for a new health paradigm. When you say that, what is your intention behind it?
In Scripture, God Himself is speaking, and He says, not a prophet, messenger, or disciple. God Himself is speaking, and He says, behold, I make all things new. And a reasonable person with reasonable understanding would raise the question, why is there a need to make all things new? Because the world that is now ending, called the West, it no longer has any power, and all of its systems are now failing because its time is ended. And so, if we have known Western medicine since the advent of Hippocrates, and his vision for treatment of health has come to an end, then obviously a reasonable person who understands time would know that something needs to replace it. And so there is a need for a new health paradigm because the old one has come to an end. And it was never really effective, but even the little effect that it did once possess, it no longer possesses it. So we have to develop something that's new, that's non-invasive whenever we can, that's non-toxic, and that's affordable, and that will actually work to repair the health of the human being.
What would you attribute this current environment in the health arena to the lack of its effectiveness? Because I was looking at a report today that dealt with the COVID cases in America and around the world. And though America is considered a first world country as it relates to its healthcare system, the amount of cases and the amount of death and the amount of, well, those two things, they lead the world in this. And you have other countries that are considered third world countries that don't have the type of healthcare system or the type of innovations that they have come up with in health, not suffering as much infections and deaths as they do in America. Knowing the healthcare system, do you see anything that would cause this to be the case?
Well, people who study health, people with biological and medical backgrounds, have known for many years that the American people are some of the most unhealthy people on the planet. Other people who have had the privilege of traveling outside of America and understanding that CNN, Fox, and your other news agencies are not known for telling the truth about the realities of the world. Many would argue, and I would personally agree with them, that disease and sickness is not something that is ordinarily found in your so-called third world countries, or if there's a such thing as a second world, your second world countries. Many would argue, and I would agree with them, that much of the disease and sickness that you would find in so-called third world countries are artificial, meaning those diseases were taken there by people. They're not diseases that just occurred through natural selection. Ebola, HIV, and other so-called diseases, I believe, were taken into those countries. And with regard to COVID-19, I am leery to address COVID-19 because I'm not sold on what we are being told is COVID-19 or coronavirus. I'm not sold on it yet. And so I would rather not comment on it because I would be a hypocrite if I did, because I wouldn't believe what I would be saying to you.
Is that based on the science that you would need to have to prove your statements?
Frankly speaking, I can't speak for anyone, any other person, but I haven't seen any science on coronavirus or COVID-19. I worked with coronavirus 31 years ago in a laboratory doing research on it and some other viruses. And I recently spoke with some of the scientists with whom I worked on coronavirus. And we all agreed that what what is being reported today is not what we found 31 years ago when we worked with coronavirus. So um, I haven't seen any science. I've heard people talking. I've heard mostly reporters talking. I've heard Dr. Fauci talk. And I don't trust what Dr. Fauci says because Dr. Fauci has never impressed me as a researcher. If I'm not mistaken, Dr. Fauci is an MD and not a researcher. And so I haven't had any data that I trust that would cause me to go along with the narrative that's being presented regarding COVID-19. So I would rather just remain quiet about it.
To get back to the reason we're here today, which is to discuss the introspective view of NHP, excuse me. What, how would you introduce this new health paradigm to people who have become used to the old way of how medicine is being, or healthcare is being administered to people?
The the manner in which I introduce the new health paradigm is replacing the old with the new. Um, Language is important, but practicality is more important than talk. And there are many who claim to have treatments for this and treatments for that. But at the end of the day, the people who go into the institutions to be treated, they're still dying. And so for a person to suffer with what is called diabetes for 30 or 40 years, something is wrong.
Okay.
You see, is what you take is what you're taking working? If you're taking if you're suffering with diabetes, and I'm not picking at diabetes,
Right.
but it's a very common quote unquote ailment. And it's one that probably most African Americans can relate. So if you are being treated for diabetes for 30, 40, 50 years, then there probably is something wrong with your treatment regimen. And this is why there is a need for a new health paradigm, because this is unnecessary and it's unacceptable and it's run its course.
So, in the current health environment, the major method of healthcare is prescription drugs. What has this methodology contribute to either the benefit of health or the demise of people in the arena of health? To your knowledge, do you see them as being, if you were to weigh the good or bad and find a medium, is there a good or bad with prescription drugs, or is it just that, is it a business?
The Honorable Minister Louis Farrakhan, 32 years ago, when I was a younger minister in Washington, D.C., said these words to a room of ministers. He said, "Brothers, always teach the balance." So I will be the first to acknowledge that Western medicine does have some benefits. It does. But as you've heard me say a multitude of times, the deleterious effects of Western medicine far outweigh the minuscule benefits that it provides. So I would encourage each person who views this video to get a book on pharmacology. Pharmacology is the science of pharmaceutics, the, the science of the effects of drugs or the active ingredient in drugs. Get a book on pharmacology and just read it. Just start reading. If you want to continue to take pharmacy drugs after reading the book that is used to train anyone who has the authority to write a prescription, then there's not much more than a person like me can say. And so see if you can get your hands on a copy of a physician's desk reference. And then you read the side effects of the drugs that are prescribed to you on a daily basis. If you choose to continue to take drugs after reading that, then there's very little that a person like me can say. Pharmacies, pharmaceuticals, drugs are poisons. They are chemicals. They are poisons. They are designed to kill poisonous cells. And so while they do have sometimes some benefit, while you are taking the drug to cure or treat one problem in your body, because of their toxicity, they're creating another one, such as destroying the lining of your kidneys, destroying the lining of your liver, uh, and a whole host of other problems. And so taking drugs is somewhat like a catch 22. Once you start, it's very difficult to stop, because once you take them to treat one problem, they create another. Then you take them to fix that problem, then it creates another. Then you take him to fix that problem, and it creates another. And now your doctor is telling you now, come back in 1 month to see me because they know that you're going to come back. you know, I'm not making light of
You,
the situation.
well, in any serious conversation, there has to be a bit of levity because it affects so many people, and
Right.
so that's understood. Um, you refer to the PDR and how that is used in the system of medicine that the current environment of health uses. Why is there so much misdiagnosis? No, excuse me, I'm sorry, misprescription of drugs in the environment that you just spoke of? Because these are people who went to schools, paid hundreds of thousands of dollars to become someone who is able to be able to prescribe these drugs. However, I don't know of many people who have gotten well on the use of these drugs. So, and they're supposed to be experts on it. Why is there so much misprescription of drugs amongst the current system of health?
I don't know if I would use the verb misprescribing as much as I would use the verb overprescribing. I don't think they misprescribe. I think that the years that I spent working and doing research in the different medical schools and sitting with the research team on Thursday mornings to discuss the forward motion of research on a particular disease, there would be a pharmacist sitting at the table, a bioethicist, a endocrinologist, a, a general practitioner. There would be your scientist, the PhDs and the master's degrees. Um, and if you sat around that table and listened to the discussion, or if you were in the medical school working and you took courses with the medical students, you would hear how they are trained to prescribe 3, 4, 5, 6, 7, 11, 13 different drugs to one patient. And the people out there know that I'm not exaggerating. And so when you place that level of poison in one body, then there is no question as to the amount of side effects that are going to come from placing that much toxicity into your body at one time. So I wouldn't label it misprescribing because they know what they're doing. Are there times where they will make a mistake and misprescribe? Yes, that does happen. But I think the occurrence of overprescribing is far more frequent than the occurrence of misprescribing.
Well, that answered the next question that we were going to ask. So thank you for that answer. Doctors and misdiagnosis. Had you found in the history when you were dealing with doctors that they would misdiagnose a lot of people? I know a couple of years ago when we first got together, there was an article that said that people who have cancer are prescribed chemotherapy, knowing that the efficacy of chemotherapy does not really fight cancer. So these type of that's not really a misdiagnosis, but the treatment is a misdiagnosis, and how do you, as a person going in to see your doctor who you trust, determine whether or not they actually are diagnosing you correctly?
The the thing that I would recommend in any individual who has been diagnosed with cancer is to get a second and a third opinion. When you go for the second opinion, do not mention the first opinion. If you go, you say, I want a general checkup. Do not allow yourself to be referred for the second opinion. Make it a cold call, a walk-in, and you don't mention the previous diagnosis. You walk in and you say, well, I'm having a pain in my shoulder. And you allow them to run tests. And if they arrive at the same conclusion, then I would still go and get a third opinion. And I would be leery to begin taking chemotherapy. There's very little evidence that it works.
Hmm.
And I believe it's Health and Human Services, the U.S. Department of Health and Human Services. I believe it's that entity that reports each year the numbers of misdiagnoses for diseases and for cancer in this country each year. And if you go and research that, the numbers might shock you at how often people are misdiagnosed for cancer and they never had cancer. So that might be something that you would want to go and research.
Thank you. Um, the introspective view of the new health paradigm, what is it that you want to relay to your listeners today who have come to Life Sciences How to Eat to Live Facebook channel to hear of the future as you see it, as much as you want to um, disclose to us today?
2018 was the first time we used the phrase new health paradigm. We had kept it under our hat and close to our chest for the last 28 years. We first saw the advent of the new health paradigm about 29 years ago, but I did not believe that it was the right time to mention it because I wasn't strong enough and I didn't have all of the pieces. And it wasn't until 2018 that I could see the complete picture of the new health paradigm. So in 2018, we mentioned the new health paradigm in a public forum, just like this one. Since that time, as, as recent as last week,
Yes.
we heard the recitation of new health paradigm in another group's, another person's language, another person's program. And that caused some concern for me because I don't want a person to take what we presented to the world, because prior to us making the introduction of the new health paradigm 3 years ago, I had never heard the phrase new health paradigm until I
That's right.
said it.
That's right.
But now I've heard it at least twice from others other than myself. And I'm afraid that maybe someone will try to get out in front of me and present their their uh, presentation of the new health paradigm and confuse you and mislead you. So we're still not going to give the complete picture of what constitutes the new health paradigm, because we know that people will take it and try and get out in front of us with it. And
Okay.
the reason that it's taking us the time that it's taking us to do it is because it needs to be properly done. It's not about making a lot of money. It's not
Mm.
about being the first to do it. It's not about impressing people. It's about taking something that, if we take our time and fully develop it, we're working every day. I'm up at 4:30, 3:30 in the morning. I'm awake working on this new health paradigm, because it has multiple components and multiple facets. Each one of those things have to be in place before we can launch it. Otherwise, it becomes a mess. If we prematurely launch it, then it becomes a mess, and it confuses people, and then it's ineffective because
Right.
we launched it before it was fully developed. And so we don't want people to be confused by hearing others use this language of new health paradigm, because unless you hear it from me, then it didn't come from me.
Well, thank you. We're coming up on the 30-minute mark of the interview, and I think that we've covered all of the points that you intended to cover, and I think that I've asked all the questions that I intended to ask of you as it relates to the NHP. What are what benefit would those who are currently in the field of health get from contacting you to see the new direction of health in their own practices today? Because there are many people that have practices, and there are many good people who want to help people. But if you only have the old methodology, you probably can only get the old result. So, what would you say to those that whose ears you've piqued and are interested in coming to know more and helping you, because help is needed in the new health paradigm?
Well, I would say to them this: Western medicine is moribund, it's dying, and there's nothing that can be done to temper that fall. Western medicine is dying. It was written many thousands of years ago that it would die during this time period. At the onset of Western medicine, the people who founded it and developed it knew that it would only last for a certain period of time, because it was based on lies, deception, misuse, distrust, abuse, and deceit. And the day for all of those things has come to an end. And so now, um, if you want to be successful in the use of using your knowledge to heal people and treat people and improve the health of people, then you will have to change. You will have to change. And if you want to be involved in what we're doing and you're willing to listen, then get in touch with us. And we will begin to work with you so that you can utilize the fundamentals that you were given in med school or dental school or vet school or pharmacy school, And we will show you how to take that training and then use it in a format where it can be beneficial to the human family. America really is the leader of the world. America really is. Uh, and America does have people in it who are good. They just have been misled for so long. And I could not have done 10 years ago what I'm doing today or 20 years ago. And I did not understand why I couldn't do it until now. And the reason that I could not have done it 10 years ago or 20 years ago was because I was too angry and I was too full of hatred. And I did not have the loftiness of understanding that I've been given today through time. And time has allowed me to grow and grow out of the anger, grow out of the hatred, grow out of the pain from being a Black man in America now for 56 years. So I couldn't do 20 years ago or 10 years ago what I'm doing now because anger got in the way and I only wanted to help the African American. But now I see that the problem about which we're speaking now affects the entire earth. I've had the privilege of traveling to more than 40 countries in my life, and I've gotten to see how other people live. And the entire world is suffering from the advent of Western medicine because it has pretty much permeated civilized society. And something has to be done to help. So, this is why the time is right now. And we believe that the time is now right for us to work with others so that we can begin the healing process of the entire 196,940,000 square miles of the planet Earth.
Well, thank you again for coming today and sharing with us your biomedical research science knowledge as it relates to our health. Um, those of you who would like to get in contact with Mr. Victor Muhammad, you can do that easily at natures, naturs-v.com. We do take our contact with the people who call us very seriously, and we will return our calls. We thank you all for coming out tonight. We thank you, Mr. Victor Muhammad, for sharing the NHP with us, the New Health Paradigm, um, your view of it, and we hope that everyone that listens tonight to Life Sciences How to Eat to Live Facebook channel has gained something from this night and information. I will leave you all with the greetings first to you, Mr. Muhammad, and the greeting to our viewers. Have a good evening.
Thank you.